Good morning, everyone. Welcome to Team TDF Wellbeing Webinar. My name is Irena Piotrowska, and I am one of the practitioners at the Disability Foundation. I am an acupuncturist, and today we will continue learning how to do acupressure protocol for COVID-19. Remember, all of your devices and microphones are switched off. No one, including me, can see or hear you. So if you have any questions or want to say something, please write to us an email. TDF is a charity that relies on donations. Please give what you can. Now, make yourselves comfortable and minimize the distractions, like turn your phone into silent mode. Always talk to your GP first if you have any doubt. Remember, it is a complementary treatment. Each webinar covers one topic, and I explain location of every point from basics during each of the webinars. So if you are here for the first time, I am pleased to welcome you, and I hope you'll enjoy the session. The guided part of the session will last till 12:30. Do close your eyes if you feel comfortable to do so. I will summarize what we are going to practice today at the end of the session. Please remember to participate according to your own abilities. Acupressure has no side effects besides possible bruising and soreness of points. Please apply an amount of pressure that you feel comfortable with. You can stop and start at any point during the webinar. You are in charge. The session will end at 12:30. If you have any questions after the session, want to suggest subject for sessions in the future, or want to get in touch, email us at therapysupport.tdf.org.uk. And without further ado, let's start acupressure. I will explain everything while we practice, because we don't have much time. So the first point is lung 7. We know it already pretty well. When you place your arm like this, abduct your thumb. This is the sniff box, anatomical sniff box, and just move your finger proximally over the bone. This is the styloid process of the radius, and right after, next to the bone, you will find a depression between two tendons. So this is the point. This is lung 7. Again, abduct finger, anatomical sniff box. Move your finger proximally, and here we are, between the tendons. This point is paired with point on the feet, on the foot. So to find it, just find medial malleolus and slide just underneath it. So medial malleolus, slide underneath it. You press this point and this point simultaneously. Yes, under medial malleolus and proximally to the styloid process of the radius, and press. Try to press it perpendicularly to skin. Just press. These points work best when pressed together and perpendicularly. If you are getting tired, it's fine. Just press and lift, but just press. use any point you want for pressing anything. Just make yourselves comfortable. So we'll switch sides. So now we'll work on the right side. Whoa, sorry. So again, fine, place your hand like this, anatomical snip bugs. Move your finger towards the direction of elbow, and right next to the styloid process of radius, there's this depression between the tendons. So that's the point. You may mark it with your nails. And now let's find kidney 6, medial malleolus, and slide underneath it. So press here and press here. Feel the tendons and be between the tendons. Just press. Please make yourselves comfortable. I am obviously not comfortable, but I want to show you precisely how to press, where and how. So try to press perpendicularly. If you don't have enough strength, then lift and press, lift and press, lift and press. But if you can, just press it constantly. You may do just little motions, circular motions in one direction, another direction. Try to stimulate the point. Just stimulate it. Press. I give 2 minutes for each couple of points. Yes. Press. So now we'll move to the next points. So next couple of points is pericardium 6. When you place your fingers like this, the point is in the middle between the tendon, right under the index finger. When you do fist, you can feel the tendon, so it's here. It's in the middle, yeah, on the middle line. It's here. And the point that works with it is spleen 4. Spleen 4, sorry. I need to go the other way. So, spleen 4. Okay. Spleen 4 is located on the... I'm sorry, I didn't sleep well today. I'm very sorry. It's here on the medial side of the foot. So you have to slide your finger on the first metatarsal bone, ideally underneath it, just underneath it. And when you find the base of the first metatarsal bone, that's the point. So pericardium 6 and spleen 4 on the medial side of the foot. Yeah, right under the first metatarsal bone. Under, you'll find the base of the bone, and here, press it perpendicularly and simultaneously. Perpendicularly, simultaneously. Again, you can make the circular motion over the point and the other side. Or if you are tired, you can press and lift. We'll move to the other side. So again, the same 2 points. Pericardium 6, place your hands like this. You start with ring finger on the wrist line, and it's in the middle, right under the index finger. I'll make a mark with my nail. And the other point, it's located on the medial side of the foot. So you slide your fingers on your finger on the first metatarsal bone, underneath it, a bit underneath it, and you'll find the base on the point. It's here. And press these 2 points. Just press them simultaneously. Press. My timer. Okay, just press these points. Press. Try to press them continuously together at the same time and perpendicularly. If you can't press it constantly, just press and lift. Press and lift. We press these points just for 2 minutes for each pair, including locating the points, time needed for that. But at home, try to press them till you feel warmth. Then you know that you have stimulated the point, that you have activated its potential to work on your health. Just press and lift, press and lift, press and lift. Please continue pressing. Repeat. Sorry. Okay, next 2 points. This is Sanjiao 5. Sanjiao 5. This is located on the same level, on a different side of the arm. So if you find the first point, then you have the other. It's in the middle. It's located in the middle. It's like 2 thumb width away from the wrist. So just let's make a mark here. And the point that goes with it is gallbladder 41. It's located between the 5th and 4th metacarpal bone. So if you slide your finger toward the ankle and start moving your fingers, flexion, extension, then you'll feel the tendon here, and the point is right behind the tendon from where you were sliding. So it's on the lateral side towards the on the side of little toe from of the tendon. So press this point and press Sanjiao 5. Yeah, there's 2 points. Sanjiao 5 and gallbladder 41. Sanjiao 5 is located between the 2 bones here. Just press it perpendicularly. So now I have a few more seconds to introduce a bit more about the theory. So what we are doing here is based on Chinese government guidelines. And we switch the side. I will continue after that. So we'll find Sanjiao 5. It's here. I'll make a mark with my nail. And again, gallbladder 41. It's located between 5th and 4th metacarpal bone. So when you slide your finger between these bones and start flexing and extending, you will feel the tendon there. So just past the tendon, it's right there. The point is right there. So press it. So as I was mentioning before, the acupuncture protocols are relevant and based on the Chinese government 4-stage differentiation scheme for treating COVID-19. It is based on the study published in June 2020 in Journal of Chinese Medicine. Today we are working on intermediate stage of the disease. Just press perpendicularly, ideally, and continuously. So there are 4 stages and there are 6 protocols for them. First, I wanted to combine all the protocols, the protocols that are in each stage, if there are more than one, into one session. But I thought of it and decided to do one protocol per session. Now we are going to have easier acupressure points to press. No more a couple of points together, but one. So the first one in this stage, intermediate stage, additional, next that is a single, it's located on the back. So if you bend your head, the most pronounced vertebra is the 7th cervical vertebra. I'm not sure if you can see it, but for sure you can feel it on yourself. And just move 1 vertebra, 2 vertebra, 3 vertebra below it, and it's located next to these vertebrae. And press these points. Next, in like these two finger width together away from the base of the vertebra. So find the base of the vertebra, 3rd thoracic vertebra, and press. So once more, when you bend your head, you will feel the most pronounced vertebra, it's 7th cervical vertebra. We want to go on the level below the 3rd. So we go 1 vertebra, 2 vertebra, and 3rd vertebra, and we press. We can use both hands. This way we will press them simultaneously. Yeah? It is a point called gallbladder 13. Bladder 13. So just press, just try to stimulate this point. Now we are going to press point called REN 12. It's located on the belly between this sternocostal angle and umbilicus. It's in the middle. To find the sternocostal angle, follow the rib cage, the ribs, and it's in the middle. Just press this point. This point is located on the midline, so this is just one point, because other points, when they are located on the side, they are located bilaterally, so there are actually 2 points that are called the same and have the same functions. There's only 2 of them because we are symmetrical more than not. So just press this point. The next points are located on the line, on the level of umbilicus. So you need to go 2 thumb width away from umbilicus, and it's located here. It's stomach 25. Press them simultaneously. Yeah. 2 thumb width away from the umbilicus, from the midline. Just press these 2 points. Press and lift, press and lift. Just press them. I advise you to download the the article we are working according to. Repeat, because then you have all the points, and you can read a bit about the theory behind. Next point that we are going to practice is lung 5. It's located on the cubital crease. So here is the tendon. When you do a fist, you can feel the tendon better, and you go to the outside, the lateral side, the thumb side, and press. So I strongly advise you to download this article, because then you don't have to remember the points. You'll have them, and there is bigger chance that you will be able to use the protocols depending on the stage you are in. And the other benefit of having this article that is made publicly available is that you can read about the symptoms. I don't have time to go over it. So again, on the other side, this is the tendon. Here we have thumb, and we go to the side, to the lateral side. We are on the cubital crease. Just move this way and press. So what I want you to keep in mind is that the same disease develops differently. Obviously, it gives different symptoms depending on the patient, but it gives different symptoms in different length of time as well. You can have it, and it develops very quick from initial stage into intermediate stage, and hopefully next the recovery stage, but without severe stage. But you have to watch yourself, because it may progress really fast, like over the night. The symptoms can change. So that's why I ask you to read this article about the 4 stages that we are working on. The next point is lung 10. It's located here, like in the middle of first metacarpal bone, and it's located on the line when there's red and white skin. I can't show it to you in the slide, but there's usually you can find where is this line, and just press. This point is lung 10. Let's move to the other side. So it's located on the thumb, and just press like in the middle. Press. And the bone is here, so you like press in the towards the fingers, in the direction toward the fingers. No, away from the bone, but towards the finger side of the bone. And press. This is lung 10. Press. Just press. Repeat. The next point is located under the knee. So to locate it, you need to find the head of fibula. Fibula is the side, lateral side of the leg. It's under the knee, and it's here. When you find it, just slide your finger to the anterior side and inferior side. You will find yourself in the depression there. So again, the head of fibula is here, and you slide to the front and under. Yeah, anterior, interior movement. The length, if you want to be like check if you are in the right position, it's one thumb width away from the head of the fibula and one thumb width underneath it. So now on the other side, this is the head of fibula. So just slide to the front and underneath it and press. If you are not sure about the location, just do this. Just do this. There's absolutely nothing. No, it's not contraindicated. Just press the bigger area. And if you're not sure about in this direction, just press or use more fingers. But let me, the head of fibula and here. Let me tell you, when you are using your thumb, you are covering big area. So you are in the right spot. Just press. Now we are going to press stomach 40. It's located between the line of popliteal crease and lateral malleolus. It's like in the middle, and move to the front. Find the anterior crease of the tibia and move 2 middle fingers width away from it and press. So it's in the middle between the popliteal crease and lateral malleolus, and from the anterior crease of tibia 2 middle finger width away and press. And on the other side, lateral popliteal crease, lateral malleolus, find the medial line, and here we are. You can press it simultaneously. I need to hurry up. Now we are going to press gallbladder 40. So gallbladder 40 is located underneath, under the lateral malleolus. You go like underneath it and to the front. You will find depression there and you press. So it's gallbladder 40. If you can do that simultaneously, on the other leg, I can't show you this, but find the lateral malleolus and slide underneath it and to the front. Inferior, anterior directions of movement, and just press both of them simultaneously. If you can do this, do this. Just press. Okay, and the last point, I leave it to the last to press it at the end because I want you to remember that best. So this is located under the kneecap. There are 2 depressions, and when you place your hands like this, you are the point is right below it. 1 finger, middle finger width away from it. So it's here from the anterior crease of tibia. So, and here, the anterior crease of tibia, 1 middle finger width away, and press. So what we've done today is a protocol for treating COVID-19. This is the intermediate stage. We've done last week the initial stage, and this is the intermediate stage. First of the scenarios that are in the intermediate stage. So please press this point until you feel warmth and soreness, that's how you'll know that you have stimulated it. I assume that you don't have COVID right now, so I am stressing to press this point because it will strengthen your immune function and you will just fight infection if it comes your way, any infection, better. Please continue on pressing this point. Thank you to everyone who participated today, and please attend again. Please else tell your friends and family. If possible, if you like this session, please support the charity work. Thank you very much for feedback. I hope you will have a lovely weekend. Stay healthy and see you next time.